Opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Hello there, my dear listener. It is awesome to be with you, wrapped up in the electrical vibrations of the radio waves on this glorious Monday morning. You could have gone left or right down that spacious dial, but you chose to park it here at WMNF Tampa and the Healthy Steps radio show with Dr. Fred Harvey, the best little community-supported radio station under the moon and the only radio station that Wendy Torrance has ever streamed, and you can stream us as well at WMNF.org. And as you know by now, the Healthy Steps radio show has no limits if you are willing to participate. Today is Ask Me Anything Monday. Do you have any medical questions or concerns? And I know that you do. Then you are cordially invited to participate by calling 813-239-9663. Irene is sitting high in the control chair awaiting your call. So let me repeat that number. It is 813-239-9663. You can send an email to dj@wmnf.org or text us at 813-433-0885. Good morning to you, Dr. Fred. It is always good to settle in for an exciting AMA Monday, so let's get started. What have you been cooking up for us today?
Well, good morning, Bill. Thank you for that intro.
My pleasure, as always there, Doctor.
And to everybody, I just want to remember our fallen defenders. Today is Memorial Day, and I just want to thank everyone who's given service and who's given their lives for our nation. That said, I want to welcome you to another episode of the Healthy Steps Show. And as usual, I found something else to talk about. I think you might have expected that. Once again, the mainstream media and mainstream illness care medicine is firing shots at functional medicine. It's really sad when people who are clueless attack people who understand. It's really a troublesome situation, but it happens all the time. People don't like change, especially when change is part of questioning the very foundations of the paradigm that they worship. At the ivory towers of establishment medicine, we worship illness. Yes, we do. We don't worship health in establishment medicine because establishment medicine is focused on illness. It is exceptionally good. And I know because I've been there. I was trained in this. Exceptionally good. In fact, it's the best at describing illness. We have book upon book upon book upon book, thousands and thousands and thousands of pages, millions of words describing illness because that's the paradigm. It's an illness paradigm. It's a poverty paradigm because it always looks for less. Think about that one. It looks for less. It looks for illness, which is less because wholeness is more. It doesn't look for wholeness. There's nothing in the equation of the Western medicine paradigm that looks for wholeness. It doesn't look for more. It looks for how to make less of less. Yes, think about it. We're actually using these chemicals and knives and energy beams to actually make less of less. We're making less of illness. We're not making more of human health. We're not building up the body. We're making less of less. We're making the illness ill, so to speak. So the illness dies and not the human. It's a really weird paradigm. And so it's no wonder that when a novel way of looking at a very complex illness comes along, that the establishment pushes back against it. It's also understandable because the establishment is based in making money, and it makes money by making pills that they throw at ills. You know, there's a pill for every ill and maybe 20 pills for every ill in this paradigm, because once you start one pill, you need to take another pill to take care of the adverse consequences of the first pill, and then you take a third pill to take care of the adverse consequences of the second one. You keep adding them up until you get 20 pills, the first of which treats a problem, maybe, and then the rest treat the adverse consequences of the problems created by the first pill. This is our paradigm. Think about it. So I believe it was in 2007, 2008, that this brilliant guy named Dale Bredesen, who's a conventional neurologist who had a wife who's a functional medicine doctor, convinced him to look at Alzheimer's disease differently. Yeah, Alzheimer's disease. We have an epidemic of dementia. And Dr. Bredesen took some time and actually described dementia in a new way. He looked at Alzheimer's disease and said there's a bunch of different ways this occurs. Look at these people over here that actually have the classic Alzheimer's disease. Well, they have a genetic abnormality that predisposes them to that. And then there's a second group here that seems to have diabetes, sugar problems affecting the way the brain works and causing inflammation in it, oxidative stress and brain destruction. Then there's this group over here that has toxicity. They have mercury, or they have this, or they have that, and these things are actually damaging the brain tissue. And then we have a group that has had vascular illness. And the vascular disease has caused slow blood flow to the brain, starving it out and causing it to dysfunction. These are all iterations of Alzheimer's dementia. And so, because there's no one type of dementia, the establishment has done an amazing job of finding like 300 different pills that don't work, many of which actually make it worse. The current one that was, I think, 2021 or 2022, that the FDA director decided to approve, even though it doesn't work and kills people, causing strokes, he decided to give it to people because somebody might want to buy it. Well, who's desperate enough to buy a medicine that's going to give you a stroke and doesn't treat your Alzheimer's? I guess people that have been lied to? I don't know. So they really don't like it when people get better without medication. And so many people have been riffing on Dr. Bredesen's book, End of Alzheimer's, worth a read. It's very complex, worth doing though. So he describes 36 holes in the roof that you need to patch so your brain can work again. What he describes eloquently in the book is classic functional medicine approach to human health. Looking at the dysfunction in all the different systems and looking for ways to actually make the systems all work better together. That's what we do in functional medicine. We uplift the individual by removing dysfunction and improving function. We treat health, essentially. We enhance health through our programs rather than treating illness. And we found that treating Alzheimer's doesn't work. Everybody knows this. There are no medicines that treat it. There are some that are approved to use in it, but they don't treat Alzheimer's. They delay the slow deterioration. And so the New York Times put out a new article about little hope for the people going into this protocol. Well, one of the things that was noted in this protocol, and it's really brilliant, Dr. Bredesen himself mentioned it because he was interviewed by the New York Times about this. But people are coming into this program too late. You got to come in when it's mild, when you have mild cognitive dysfunction, maybe up to moderate. Advanced Alzheimer's doesn't respond well because the brain's destroyed. You know, once your brain is unraveled at age 75, it's hard to put it back together. But if it's just beginning the process, we might shift it. But I got to tell you, if you're on Facebook or you're on Instagram and you're reading about how lion's mane mushroom is going to cure everything, that person's lying to you. So don't buy their product. It doesn't work that way. It's too complex. And so reviewers have described the entire functional medicine protocol and then made fun of it because it doesn't actually look for a single weapon. It doesn't look for a pill to cure your ill. It actually does rational medicine where it tells you, you have to fix all these things in your life or you're not going to get better. They try to refute the fact that cognitive decline in Alzheimer's disease. Well, they can, and we know this, and there's evidence. And I'm not going to go into it here because that's a master class that'll take all day. And certain dietary factors promote Alzheimer's disease by causing inflammation? Yeah. When you eat food that has mercury in it, mercury causes oxidative stress and causes your brain to unravel. We even have video that shows exactly how the mercury destroys neurons in the brain. So yeah, dietary influences do this. So you can get your mercury out of your fish and you can cause brain damage. And also, glucose has been shown to increase oxidative stress and cause increased rapidity of deterioration of the brain function in dementia. So yes, dietary factors promote to it. I don't know what these people are actually talking about when they're doing these reviews. I don't know what they're looking at, but and then they say insulin resistance contributes to Alzheimer's disease. Of course it does. In fact, diabetes type 3 is another name we functional doctors have for Alzheimer's disease. But, you know, they have to actually take down the author, not the actual science. They criticize Dr. Bredesen because obviously this is a non-scientific approach because we don't have a magic bullet. There aren't any. They don't exist even in Western medicine. And they criticize it because despite no other approaches having shown evidence, well, the other approaches are pharmaceutical approaches. They're one bullet. Here, take this bullet. You're a werewolf. It'll kill the werewolf in you. It's just so weird to think that something as complex as Alzheimer's disease, which is old people's autism, in a sense. They're different, I guarantee you, so don't quote me. But the bottom line is autism is a very complex illness. And though we have not found a line item vaccine that actually causes Alzheimer's, vaccines contribute to autism. Because again, it's like with Alzheimer's, it's multifactorial. There are numerous things that come to bear on a person who gets autism and Alzheimer's. And you need to actually work on those issues all together to get the job done. Another criticism of Dr. Bredesen's work is he has 100 clinical cases. Well, that's the point. He has 100 clinical cases because there's 100 people that actually got improvement. But they don't have one specific pathway. It says people were assigned to groups based on therapeutic intervention. No, they're based on the class of type of dementia, whether it's toxic or vascular or classic or hormone or diabetes related. They were put into different groups because in functional medicine, we do individualized medicine. There's not one pill to fix everybody with Alzheimer's. It's never going to happen. Western medicine is going to be pursuing that forever to try and find a profit center. But it's not a profit center. It's actually take care of your body and it won't break down. Take care of your brain and it won't break down. Or once it started to break down, take even more care of it. I mean, the simple things like the gut microbiome can change the way your brain works, and your brain can change the way your gut microbiome works. Within 2 hours, you can shift your gut microbiome by thinking about it. And if you just start modifying risk factors, if you just start taking things out that actually will cause worse deterioration in your brain function, you want to avoid simple things like smoking, alcohol, get good sleep, drink lots of water, eat lots of vegetables. I mean, there's so many easy things to do just to fix the way you're actually interfacing with your brain. Things like high blood pressure, hearing loss, diabetes, physical inactivity, sad mood, which is fixed by getting better physical activity. All these things increase your risk of dementia. So it's a very basic program that Western medicine is just not able to comprehend. And then they worry about having placebo effect. Who cares? If people get better, does it matter if they're getting better from placebo effect or for some profitable pill that some pharmaceutical company made? And they complain that there are no specific methods. Well, the method's different for everybody because in functional medicine, we do individualized medicine. We take care of individuals. We don't take care of groups of epidemiologic numbers and hope that a pill that only kills 3 out of 1,000 helps 33 out of 1,000, so the risk-benefit ratio is better. Come on, let's do rational, easy things and get things fixed here, all right? I like that idea. And I'd like to talk with you about these kind of issues. I'm just going to remind you, this is the Healthy Steps Show on WMNF Tampa.
And indeed it is. And if you are just tuning in on this Memorial Day, you are listening to the Healthy Steps radio show here on WMNF Tampa, as the doctor said. But you are also invited to participate in this show. I do have Wayne and Mary on the line, and you can join them by calling 813-239-9663. Irene came in especially today to help us with those calls, so give us a jingle at 813-239-9663. 9663, or continue sending your emails to dj@wmnf.org. And you can also text us at 813-433-0885. Let's go to Wayne in St. Petersburg. Good morning, Wayne.
Good morning.
Hi there.
I'd like to ask about where I should go to be tested, MRI scan or what, for onset of dementia.
Oh, that's. I'm glad you're looking. So there's a whole workup one can do if you're having trouble with thinking, memory, etc. And I would suggest that you look at Dr. Bredesen, Bredesen, Dale Bredeson's book, End of Alzheimer's. He has a whole list of things in there that you can do, and you could use that book as a guide to have your studies done. I like to get a full metabolic panel on someone, including their hormones, because hormone withdrawal is part of this, vascular inflammation. Quest Labs has a Cleveland Heart Labs test, and that looks for blood vessel inflammation to see how much plaque you have, and an overall cholesterol test, lipids test with particle numbers, and you want your glucose and insulin.
Do those kind of tests at your office?
These are the kind of things I do in a full workup for somebody who has cognitive decline, yes.
Can I get your office phone number from someone before I hang up?
Actually, you can probably get that from Irene, but you can check out functionalmedicineflorida.com or info@functionalmedicineflorida. Other things you can do, sir, to really help, like a neuroquant MRI measures the size of the area in your brain where the memory is most active. And so we can actually check and see if your memory center is shrinking. There's so many cool tests we can do to find out where you are right now and things we can do to intervene to help you get better.
That's great, Doc. I appreciate it. I'm going to get the numbers and make myself an appointment. I appreciate your radio show. Thanks for being there. Goodbye.
You're so welcome. Have a great day.
Thank you there, Wayne. And that last phone call announcement really lit up the boards. I've got Mary, who's been waiting, as well as John and Al that have climbed on in. Good morning, Mary.
Good
Hi,
morning.
Mary.
Hi. This is really not on your topic, maybe. I don't know. But I would like to hear your thoughts about CPAP machines or treatments. I am currently being treated for a mild sleep apnea, according to my sleep study. And it was supposed to help lower my blood pressure. And I think it's working, but I don't know. I just want to hear your thoughts on it.
Sure.
I'll hang up and take it off the air.
Okay. So Mary has sleep apnea, obstructive sleep apnea. CPAP, continuous positive airway pressure, is a treatment, and it is a treatment that is done by having you wear a mask or a nose pillow kind of device that helps air get through your nose and into your lungs. Obstructive sleep apnea is kind of severe snoring. You just don't move enough air through your throat when you're asleep. And so the machine helps. And some of the consequences of having sleep apnea, which results in no oxygen going to your brain during the night. Dementia is one of the complications. So is stroke, high blood pressure, diabetes, fatty liver, cancer, basically, you name it, you can get it from sleep apnea. It's devastating to the system, so you really want to treat it. And other options out there for mild sleep apnea include dental splints. You put a thing in your mouth that holds your mouth shut so you can't snore, and you have to breathe through your nose. There's also a new device where you stimulate the base of the tongue, kind of like a TENS unit for your muscles in your back. And over time, that seems to change things. So there's a bunch of different methods, but in fact, the CPAP issue is a bit on topic today because you will damage your brain if you don't get oxygen at night. Thanks for the question, Mary.
Okay, great answer as well. And let's go to John in Tampa. Good morning, John.
Hello there. Thank you for taking my call. Appreciate the doc's work. It's important to us all. I wanted to speak to you about how this is a little off topic, perhaps. My daughter, who's 23 years old, she is having a hard time keeping food down these days. I guess her medical practitioner is speaking to her about stomach acids and acid reflux and things of that nature, but she struggles even sometimes to keep down water. She's so emaciated, much more than ever. I mean, she's not, I don't believe, to a critical stage yet. But
Well, has she seen a gastroenterologist?
No.
Oh, okay. Two things. With something this severe, I would get an evaluation by a gastroenterologist. I have known that some people with severe small intestinal bacterial overgrowth can't keep things down, and people who have mast cell issues. Mast cells are allergy cells on the lining of the gut, and they get triggered by a lot of different foods. And sometimes they actually are made worse by being exposed to mold. Mold exposure can do this. When I was living in my moldy house, I woke up every morning and had an episode of vomiting.
That's a possibility.
So I think she needs an evaluation.
Yeah. She vapes hemp oil.
Okay.
This may or may not be related. I don't like the practice.
Well, is she vaping THC or just some generic, CBD stuff, or is she getting that Delta 8 stuff? What is she doing?
Exactly, I don't know. She does it to help her remain calm. A bit of a, what do I want to say, an excitable moment, or.
Does she have a medical cannabis card?
Yeah, she gets this at a little.
Okay, so if she has a medical cannabis card, there is something known to occur in people that use too much cannabis. THC can induce a constant nausea situation. This is a known adverse consequence of doing too much THC, and vaping enables too much THC intake.
Mm-hmm.
So it could be nausea coming from that.
Yeah, very well can be related.
She needs a doctor.
I'm sorry?
She needs a doctor, not a healthcare practitioner that's telling her that it's stomach acid stuff.
So a gastro...
even a general doctor, but she needs somebody to start an evaluation. And a gastroenterologist could do an endoscopy and see if there's anything in her stomach that's doing this. Could do some lab work to see if her pancreas or her liver are a problem. But I think she deserves a bit more attention than what she seems to be getting.
And that is an endoscopy?
What I would say is she needs a doctor, an MD. It doesn't sound like she's seeing an MD doctor.
Yeah. Okay. All right. Anything else to add?
Get her evaluated.
Yeah. Okay. I appreciate the time. Thank you so much.
You're very welcome.
Have a good day. Bye-bye.
Okay there, John, and best wishes to your daughter as well. We're down to getting close to about 20 minutes, or I guess half an hour or so, but I want to remind folks you're listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. And if you're just tuning on in and have missed me giving out the number, give us a call at 813-239-9663 or send your emails to dj@wmnf.org. And I've got Al that's been waiting in Seminole and Tom who just signed on in. Good morning, Al.
Hello.
Hey, Al, what you got for us?
I have Alzheimer's. I was diagnosed 8 years ago. I had a mini stroke and went to the hospital. And I was in the hospital for 5 days, and they did all kinds of tests, including MRI with the dye and everything, and all the gizmos on my brain, So anyway, I was just reading an article that they're connecting herpes to Alzheimer's if you get herpes when you're younger. And I've been getting herpes since I was about 15, and I get it in the same spot periodically. It's not like every year, but every other third year maybe I get one. And so I guess my question is, how do I know which dementia I have? They said 80% chance it was Alzheimer's. And my father died of dementia. They didn't call it Alzheimer's. They just called it dementia. In fact, he was in the hospital dying when I was diagnosed. And I spent a lot of time with him.
Did your father have vascular disease also?
My mother, no, she does.
No, your father.
Yeah.
Did he have heart disease?
Yeah. No,
Yeah.
I wouldn't call it heart disease, but he had high blood pressure and he had diabetes, which I also have, they tell me now.
Okay.
I also have
So
kidney disease.
You probably have a combination of classic Alzheimer's related to sugar metabolism issues and vascular dementia as well.
That's what my doctor.
What's that?
That's what my primary doctor told me to. She said it says Alzheimer's, but she said I would consider vascular. So I read all about it, and actually the vascular sounded more like my symptoms and all.
So you have a combination, though, because you have the diabetes. So you have type 1.5 and type 3 Alzheimer's disease. Type 1.5 is the sugar-related. Type 3 is the vascular-related. And you also have the fact that you have some herpes. Now, is that shingles or is it herpes simplex on your lip?
Herpes simplex.
Okay.
I get that since I was 15, and if I put the stuff on it, as soon as I feel it tingling, I put the Campho-Phenique, and it never gets worse. You know, it just goes away. But while I have it, before I put the stuff on it, I feel feverish, and half of my head feels sore when I touch my head, and it's the same side of my head that the herpes is on.
Uh-huh. So herpes viruses are associated with dementia, and so a couple things about that. If you've not had a Shingrix vaccine, the shingles vaccine, you might want to consider it because it will help prevent that. You may want to, it sounds like you're having these infections only irregularly, but people that get them more than once a year should be on an antiviral medication like acyclovir. I'm not sure that's appropriate for you, but...
gabapentin, that's supposed to be for nerves, I think.
Yeah, it doesn't do anything whatsoever for the herpes, and it won't do anything to suppress the herpes inflammation, but the shingles vaccine can. But it sounds to me like you deserve to actually pick up that Bredesen book, look at all those things in there, and start doing them, and find somebody to help you go through that and do those things and address the issues so you can preserve more function.
I have a therapist, so she could help me.
One that can write prescriptions and
No, she's just like a social worker.
Okay, you have a social worker. Good. Now I'm talking about a healthcare practitioner that is specialized in Dr. Bredesen's protocols. There's several in the area. I'm one. There's another one in Sarasota. There's a couple in Tampa. There's people all over that actually have studied Bredesen's protocols and understand how to apply it. I was doing Bredesen's protocols before Bredesen had Bredesen's protocols. I was actually helping people come back from the brink of no memory in the first decade of the 2000s because I'd already learned functional medicine, holistic medicine, integrative medicine, was applying these techniques to people and watching them get better.
Mm-hmm. Well, I just want to add that when I was a kid growing up, I used to play in a polluted creek. We didn't know it was polluted until we were ready to move. So I spent like 6 years playing in a polluted creek.
Yes.
And we used to play with mercury. You know, we'd like to break open the thermometers and watch it roll around and stuff like that.
Every one of those things contributed to your memory loss today.
That's what I figured, yeah. My memory loss is strictly short term. I can still remember things from far back, but I can't remember things like finishing a sentence. I'll get halfway through a sentence and then forget what I was talking about, you know, that kind of thing. And I spent a lot of time with my father, so I got to watch him for 2 or 3 years and how he went down. And it was like one day he was pretty good, and the next day he was pretty bad, and some days he was real good, and some days he was real bad. You know, so I'm kind of prepared for it. So.
Yes, but you know what? You might prepare yourself better by just looking at that book and applying some of the techniques, because you may really preserve a lot more function than you think you can because Western medicine doesn't have any tools to help you.
Yeah, I was wondering why the 8 years and I haven't gotten any worse than I am.
That's because you don't have classic Alzheimer's. It usually just deteriorates. You have vascular disease. So if you can keep your vascular disease controlled, you will have a much slower decline.
I do have vascular disease.
Right.
So, well, thank you. I appreciate it.
You're welcome.
Okay, bye.
Yeah. Take care, Al. Have a great day.
You too. Bye-bye.
Thank you.
All right, I've got Tom from St. Pete on the line. Good morning to you there, Tom. How are things going in St. Pete?
Probably about as hot as they are in Tampa.
How are you today, Tom?
Yeah, doing great. How are you, Doc?
Excellent. What's going on?
First of all, I wanted to thank you for the tip on the sesame oil for my skin oils, and especially for mentioning to oil your hair and scalp.
Yes.
And I have a beard as well, so I started doing that, and I've noticed that there's I don't know, I wouldn't call it dandruff, but kind of rough spots on my scalp are disappearing. And,
Excellent.
Similarly in my beard, and I think that I don't attribute that specifically to the sesame oil, but to just oiling those things in general. My question to you is, as I mentioned a few months ago or last year, proteins are a real important thing, especially as we age, and I'm always looking for ways to add more protein into my diet. That milk whey we had talked about as being a good form of protein. My question to you is on this non-fat Greek yogurt. Are there any caveats? Because it's just packed with protein. Are there any caveats to non-fat Greek yogurt?
Well, the caveat for drinking milk from a large commercial farm that's not organic is the pollution that's in the milk. So you may want to find organic yogurt. And a lot of the Greek yogurts aren't organic. A lot of these brand names are not. So you have to look for it. And I often will buy local yogurt from one of the local dairies and then make my own Greek yogurt. You use a large bowl and put cheesecloth over it and put your yogurt in that, and then you secure that cheesecloth so that the yogurt can just drip all the whey, which is the water in the yogurt, drip all the whey out of it, and so you have concentrated yogurt. It's almost like a thick cheese at that point. And so, yeah, I like to make my own Greek yogurt.
Well, Joanne, I should mention that Roland Oats carries a grass-fed organic Greek yogurt that
Nice.
is what I look for. But a good tip. I'm wondering, so the taking the fat out of the yogurt, there's nothing that that's going to cause your body any issues with having the protein without the fat.
Well, I like the fat, but not too much of it. Again, we can go over the top on fat, but I think that you want to avoid fat in the non-organic commercial products because it's the fat where the pesticides and the herbicides and the petrochemical PFAS, forever chemicals, all that stuff resides in the fat. So if you're doing non-organic yogurt, I'd say go no fat. If you're doing organic yogurt, I'm fine with whole fat, whole milk yogurt.
Well, yeah. I'm just saying if I want to, get as concentrated a protein. So personally, I like olive oil on my salad. I like to drink it.
Yeah.
So that's where I get my fat from. And then, of course, I like I love salmon, and it's got plenty of fat in there too. So I kind of like pick and choose where I'm going to get my fat from, and I try and get as concentrated a protein, healthy protein source as I can find. So I'm leaning towards, I started incorporating this non-fat Greek yogurt into my breakfast every day. And I wanted to make sure that there wasn't anything that I should be worried about on doing that.
No, that's what I had for breakfast today with some local no spray blueberries, and it was delicious.
Yep. I don't know how many people you have stacked up there, but I've been making a morning breakfast for a few years now. I put oat bran, and then I mix in the beetroot powder. When I can just look in my pantry here and see. I put a little marshmallow powder in there, a whole bunch of cacao nibs that gives it a nice crunch, and then I put the cinnamon powder in there, and then I mix in the Greek yogurt, and it's absolutely delicious.
That sounds absolutely delicious. And for people that don't know, he's not grinding up a bunch of big, fluffy, sugary, puffy things. Marshmallow root is a very good herbal for your stomach.
Right. And I tried to. I haven't had it in there right now, but I also put a berry, like a concentrated. And I guess that's another question. I use a blueberry evaporated. What do you call that? That extract powder.
Yes.
A 50-to-1. Is there anything wrong with using a super extract powder like that? And dandelion, I do the same thing with I got a 4-to-1 dandelion root extract powder that I mix in there. Anything wrong with these extract powders compared to the whole plant?
Well, like the blueberry extract is probably just actually really dried blueberry powder. I'm not sure if there's anything specifically extracted from it, if it's just actually evaporated blueberry, which is fine. But sometimes you can get too much of the substance when you're doing extracts that you wouldn't normally get when you eat it. And so sometimes you want that therapeutic effect. Sometimes it's too much for the body. But yeah, it sounds like you make a really good breakfast. I'll be over.
There we go. There we go. Have a good day. Thank you very much.
You too, Tom.
All right. Bye-bye.
Yes, thank you very much there, Tom, for making me hungry. I've got William and Jessica on the line, but I do want folks to participate and give us a call to the Healthy Steps radio show with Dr. Fred Harvey at 813-239-9663. Again, the number 813-239-9663. And there's been a real dearth of emails, so if you've got a question and a little shy, send it to dj@wmnf.org. Let's go to William in St. Pete. Good morning to you there, William.
Good morning, sir. I'm enjoying the hell out of your show. I'm wondering about the THC thing you're talking about, that it's nauseous. I always found in pharmacy to show it to be THC to be a very anti-nausea drug.
Yes, isn't that funny?
Yeah, that when I, growing up, but now I find out that it's the opposite.
Yes, and what really is the key is that it seems that CBD is the better anti-nauseant. Yeah, CBD is really good for it.
The Delta 8 versus the Delta 9?
Delta 8 versus Delta 9.
That's what's legal now versus illegal.
Yeah, well, I think that I would prefer a full spectrum hemp oil, almost all CBD for nausea, if we're going to treat nausea as an issue, and avoid the THC pretty much entirely. Delta 8, I don't recommend anybody using these other substances. Like, what's the point? Again, I got the question about an extract. These people are extracting Delta 8 from flower and then putting it into these vapes. It's a weird thing. It's so easy to get a cannabis card in Florida. There's no reason not to get one and go and get high quality controlled stuff rather than buying Delta 8 from a street vendor, essentially.
Yeah, I understand there's a bunch of alkaloids, the delta 6 THC being relevant to nausea and things of that nature. But I'm just saying, I wanted to say what I found your show is so fascinating. I loved it.
Very good. I'm glad to keep you informed. I really love doing my job.
Oh, yeah. 30 years in pharmacy myself. I'd rather watch this than porno. You have a normal weekend. Happy Memorial Day.
And you as well. Have a very good Memorial Day, and remember our fallen.
I have memory problems. I keep forgetting I have memory problems, but no one gets that joke. Have a good one.
You too.
Thank you there, William. Let's go to Jessica in Dade City. Good morning, Jessica.
Good morning. I have a question, or maybe two questions. I just want to say I get really frustrated with healthcare providers, MDs, DOs, whatever, that have what I call a twister approach to whatever it is that's ailing me or others. And I hate to say this, Dr. Harvey, but when I listen to your show, I feel like it's the game of Twister. It's put your right hand on this hip and then stand on one foot, then switch feet, and it's too complex. And I'll tell you where I'm coming from. Coming from somebody who, since their probably early to mid-teen years, has had what I consider treatment-resistant depression. And when somebody has treatment-resistant depression, as I'm sure you know, you're the doctor, and has tried medications all the way from the tricyclics back in the day to the SSRIs to all the other types of SS drugs, can't even think of the term, the thing where you put the cap on the head thing, all that stuff. I have a cousin who's been a practicing psychiatrist in the state of California for over 30 years who believes in that. But when you have these multifaceted, as you used the word earlier in the program, approaches, somebody with depression says, I think I'll just stay in bed. I cannot approach this from 20 different angles, change my diet, change, how I move my body. Oh, by the way, stop doing this and take this tincture and take this. It's just too much. And so I just wanted to throw that perspective into the conversation. It's too much. It's too overwhelming. And what I'd like to hear more of is focus. This is your priority issue. Let's focus on getting this into some kind of homeostasis, and
Jessica,
then let's approach the next thing.
I love what you just said, because that's exactly the way I work. There are multiple factors in all of these things, but when I put together a functional medicine action plan for somebody, we start with the basics. And there may be several things you need to do because you have several things that are actually making the problem worse. And so if you're eating gluten and you have blonde hair and blue eyes, it's highly likely you have gluten sensitivity, even if you don't have celiac disease. So you get rid of the gluten. Almost all of my patients get rid of the gluten to begin with because it's a toxic substance when you're toxic. And so, there are foundations that we have to do to build things up. But, part of actually living on this planet is caring for your temple. And problematically, our medical establishment hasn't actually done that for us. They've actually deluded us into thinking that they can take care of the temple for us. And so that they remove our responsibility for taking care of it. And when you are actually in an illness situation, you don't have the motivation to go and do a lot of things. I totally understand that. And that's why it's really good to have an advocate to help you do this. And that's why when people come into my programs, it's a concierge service where we actually are there to coach you through this and help you step by step of the way to do your healthy steps, because you can't take a pill and cure recidivist depression. It's not going to happen because it's a metabolic problem. And so we need to work on all the different layers of the metabolism, and that makes it difficult. It really does. And I totally hear you. And so focusing on getting rid of gluten for the first 3 weeks of a program is probably a pretty good endeavor. And then we move on to another thing that we need to address, because all of the things need to be addressed.
So what would be your first line approach for someone who has struggled with depression for many decades, on and off, but mostly on?
Have them fill out a medical symptom questionnaire so I can see which areas of their beingness are most affected by the problems. I would get, for me, it works best if I do a NutrEval metabolomic test. The NutrEval is a metabolomic test. Metabolome is that which goes on behind the scenes, not the tests that regular doctors do, looking at your blood count and your liver function and your sugar and your kidney. No, it looks at what actually drives all those numbers that the regular doctor looks at. And then we see where the imbalances are and fix the imbalances. I've seen one person with depression who, or a diagnosis of depression, who simply had very low omega-3s, like one of the lowest I've ever seen. Fish oil level was so low their brain couldn't function. So we got them on fish oil and their mood improved like 90% in 3 months. So it can be something really simple like that. It can be something really complex. And there's no way of knowing without doing an evaluation, because everyone's a snowflake. And we need to find out which snowflake you are so we can treat you the right way and help you get through to the other side.
Well, thank you for hearing me. I appreciate it.
I totally, your issue is one that everybody struggles with, which is why I stopped doing one-off visits. And we do programs because people need their hands held. It's so complex what I do. It's so hard to give up a diet you've done for 40 years, to try and change your walking style, whatever it is that I ask you to do. These are things that everybody struggles with. I did.
Right. All right. Well, thank you.
You're so welcome. Glad to be here for you.
Thank you very much there, Jessica. Let's go to Bobby in Sarasota down to the last about 7-8 minutes of the day. Good morning, Bobby.
Good morning. I got in late in this conversation today, and I've got kind of probably a complex thing to ask about, but aspirin sensitivity, asthma, and salicylates in your diet. And when you look, there are salicylates in all food almost. How would you ever avoid that?
Well, I'm not sure you need to, because acetyl salicylic acid is a very specific chemical we know as aspirin. And salicylic acid occurs in nature. Acetyl salicylic acid occurs in science. And acetyl salicylic acid seems to cause problems in a specific subgroup of people. It's a foreign substance. But salicylates do sometimes actually trigger people. And I think that the people that get triggered are the ones that are going to get triggered. And so it could be people with mast cell activation, people with other immune issues like asthma predisposition to this. So yeah, we know that people that have asthma and chronic nasal allergies with nasal polyps actually often have a third member of the triad of aspirin sensitivity. And so those people must avoid aspirin. But we may be able to look at the immune system and help it calm down by finding what other triggers are going on in there and maybe helping stabilize mast cells so they don't get triggered by the salicylates in basil or in some other herb.
Well, it's in almost all the herbs that are good for you. Thyme, rosemary, things you use. And
right.
It's not an IgE-mediated reaction, right?
Right. And so what you may want to do, because it could be simply triggering mast cells, because it is a histamine reaction, you may want to look at things that would stabilize mast cells. Even taking quercetin can stabilize the mast cell, but you may want to see what else might be triggering. And look at other food sensitivities, look at your microbiome, and really tune up the system so the immune system isn't quite as reactive. And that would make it such that quite possibly you won't be reacting to the salicylates in the herbs like you do to acetylsalicylic acid.
So quercetin?
Yes, quercetin, the red pigment in red onions and red apples, a very good stabilizer for your allergy cells.
Okie doke. Thank you.
Yes, you're welcome.
Okay, bye.
Have a great day.
Well, that wraps it on up for the phone calls here. I know you've gotten a couple of emails, and we're down to the last 2.5, 3 minutes. So let's go there, Doctor.
I shall. Thank you. So let's see. Here's one from Matt. Would ivermectin assist in suppression of shingles or herpes? I have never seen any evidence that this medication actually works on this virus. I think acyclovir is very much more specific for this. So I think I would go with that instead. Ivermectin, maybe a dose a week or something if you are dealing with a lot of animals with parasites. But no, it's not really a treatment for herpes or shingles. If you've had shingles, it does kind of make sense to go ahead and get a shingles vaccine to prevent recurrences. Here's one. Let's see. Jackie wants to know. She says, we appreciate your show, the healthy information, and my show does not have a twister effect. Diet, nutrition, exercise is not that complicated. Well, there are so many layers, and I have to agree with Jessica. Yeah, I do speak on a higher level often. I have to remind myself to make things more simple. But yes, Jessica is right that there's so many, people who are struggling with illness really have a narrower bandwidth for being able to accommodate these changes, to be able to step into a whole new world. Because when you're in pain or your mood's poor, you just don't have the confidence or the drive to go there. And so it does become somewhat overwhelming in appearance. And so I know where she's coming from. I've been there. I've had complex issues as well. But I want to tell you, I'm working over this next month to reformat the Healthy Step Show a little bit. And I would like to reach out to local practitioners. I want to do more interviews on the show. And I would like to interview local healthcare providers in addition to national ones. I have people I know all around the country and the world that I would like periodically to come in and speak. But I think it would be great to have people in our local listening area to be able to talk about what they're doing. And so I'm going to work on bringing more of that in. And if there are any topics that anybody out there wants me to talk about, or any people they know that they would like to for me to invite onto the show, I would love to hear from that. info@functionalmedicineflorida.com is the email to use to reach out and let us know what you're interested in.
I think that. Go ahead.
Oh, yeah, go ahead, Bill.
No, I was just going to say that sounds like a great idea. It'd be wonderful to have local practitioners and experts contribute and participate on your show.
Yeah, I think it'd be great because I know a lot of national people, but I'd like it to, really enliven the Tampa community and really bring some more people on here because I think they have a lot of good messages to talk about. And so, again, I'd like to thank everybody for participating on this holiday. Remember our lost ones that gave their lives for us so we could continue in this freedom. And thank you, Bill, for hosting at the studio, and Irene for fielding all these phone calls. Have a wonderful week. See you next Monday.
All right, Doctor, and thank you for a wonderful show. And until next Monday at 10 o'clock, thank you to all of our participants and listeners. And, of course, the special shout-out to Irene for handling the phones today. I could not do this show without her. To everyone out there, take care and stay healthy. You have been listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. Waiting for you is 5 minutes of NPR headline news, followed by the Sustainable Living Show, hosted by the Kalia of Sustainability, Tanya Vidovic, and Annie Ellis. So, my friend, until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, your community conscious radio station. Stay safe, stay thoughtful, and know that you are loved.